Hi, my name is Natalie Webb, and this is my healthcare system presentation. I will be focusing on the Southern American country of Colombia, which is at the most northern point of South America, just south of the Latin American countries. While Colombia is still considered a developing country, its healthcare system actually outranks the United States in terms of efficiency. The most recent updates from the World Health Organization indicate that the Colombian healthcare system ranks at 22 and the US comes in at 37 in terms of efficiency. To start the presentation, I'd like to explain why this may be the case. In 1993, the Colombian government amended their constitution to include healthcare as a basic human right. Colloquially known as Law 100, this law dramatically changed the organization of the healthcare system. Law 100's primary aim was to insure the entire country. Prior to its implementation, only 24% of the Colombian people were insured. So by enacting a mixed market system similar to the setup of that of the US, they achieved that. Insurance is obtained through either public or private insurance, based on employer-based insurance, or through a program similar to Medicaid. The major difference in these two systems is who pays for their expenditures and who's insured. In Colombia, the government is the primary payer and pays for 83% of all health expenditures. Compared to the US, this is only 28%. So as I previously stated, when Law 100 was implemented, only a quarter of the Colombian people were insured. Fast forward 17 years to 2010, now 97% of the population is insured. So this law was very vital in changing the Colombian system, and as a result, population health has greatly increased since the early 1990s. Assessing the infant mortality rates is one way to see how Colombia's population health has improved over time. Looking at the infant mortality rates 20 years prior to the implementation of Law 100, we see the IMR rates were significantly higher than they were here in the US. In 1970, the Colombian IMR rate was 0.04 deaths per every 100,000 live births, which is nearly double that of the US at 0.02 deaths per every 100,000 live births. Looking ahead after the implementation of Law 100, nearly 20 years later, the rates are down to 0.0128 deaths per every 100,000 live births. Compared to the US, it's about 0.006, so they're still about double the IMR rate per every 100,000 there in Colombia. The high efficiency ranking of the Colombian healthcare system is likely due to the differences in healthcare expenditures and the financing of the system. So health expenditures percentage of the GDP is dramatically lower in Colombia than it is in the US. In Colombia, the percentage of the GDP devoted to healthcare expenditures is 7% compared to nearly 17% in the US. That really speaks volumes when we remember that the Colombian government pays for almost 60% more of total health expenditures than that of the US government. So looking at individual expenditures, the healthcare spending per capita is only $962 in Colombia compared to over $9,400 per capita here in America. So that really highlights the efficiency of the Colombian system and also the financial inefficiency of the US system. The influenza vaccine is one way to examine preventive health in a country. According to the CDC, this vaccine is particularly important in the 65 and older population, as somewhere between 70 to 90% of influenza-related deaths occur in the 65 plus population. So in Colombia, the percentage of those who received the flu vaccine in 2016 over 60 years was 70.3%. And that's much higher than the 65 and older rate of who received the flu vaccine in the US, which was only 60% of the population. It's important to note that this is based on self-report, so while these statistics may not be entirely accurate, they do highlight the difference between the two countries. It was kind of difficult to find any substantial public health data coming out of Colombia, but the World Health Organization does publish information on their tobacco use. The prevalence of youth tobacco use in Colombia is over 10.4% of the population, and that's data based on cigarette usage only. Compared to that in the US, 2% of the youth population have smoked cigarettes in the past 30 days, and only 5.6% of the population has used any tobacco products, so nearly double the rate in Colombia as tobacco use in the youth populations. Another significant threat to public health is the air quality in Colombia. The World Health Organization commonly measures air quality by determining the annual mean concentration of air pollution as fine particles less than 2.5 microns in diameter. These very small particles pose serious health risks in high volumes. The mean concentration of fine particulate matter in Colombia is 17% compared to only 8% here in the US. So while that difference is significant, it's only a fraction of the concentration of the fine particulate matter in countries such as China, which mean is 51%. So there are two main entities that provide insurance to the people of Colombia. The first is the contributory regime, or otherwise known as the CR, which insures about 40% of the population. The CR is comprised of employer-based insurance, essentially, and also those on receiving pensions. This resembles employer-based insurance in the U.S., except for all are a part of the CR, whereas the U.S. has many different types of insurance. The second insurance provider is a subsidized regime, which resembles Medicaid in that it's a specific income level or below and who will receive that insurance. This entity provides over half of the population insurance at 51.4%, while Medicaid in the US is only around 19%. 4% of the population remains on an external source not related to the CR or the SR, while the US similarly offers Medicare, direct purchase plans, and military-based insurance. This leaves only 4% of Colombia's population uninsured, whereas the US uninsured rate is now about 8.8 to 9%. One of the major dangers to public health in the country of Colombia is violent crimes. If you've ever seen or heard of the show Narcos, you're aware of the drug-related violence that has burdened the country and still does to this day. I chose to use the intentional homicide rate for Colombia because it's the third highest in the world. The rate in 1995 was at 70 deaths per every 100,000 people, as compared to the US back in 1995 was only 8 deaths per every 100,000. Though it's decreased to 26 deaths per every 100,000, again, it's still the third highest in the world. Most interesting thing I found about this was that regardless of the intentional homicide rate, the gun violence rate in the US is still number one, while in Colombia they're all the way down at 87. To summarize the healthcare system in Colombia and the major differences that in the US, it's important to consider where the two stand in terms of industrial, technological, and economic development. As a first world country, the US is significantly more developed in Colombia, as that still remains a third world country. So it's important to keep in mind when examining and comparing public health and healthcare outcomes, as the comparison would never really be fair due to that. However, regardless of development, the Colombia system still outranks the US from 22 to 37 in terms of efficiency. This ranking by the World Health Organization is primarily based on the economic implications and expenditures per capita and expenditures as percentage of the GDP. From an economic standpoint, it's no question that the Colombian system is favorable over the U.S. This is also due to fundamental differences in the system, where the Colombian system is based on the foundation that healthcare is a basic human right. In the U.S., that's never really been the case. In the U.S., it's considered more of a commodity based on who can afford it and who can obtain it. This is related to another primary difference, and that is that the Colombian government pays for the majority of all expenditures. Again, they pay for 83% of all healthcare expenditures, while this is certainly not the case in the U.S., the government only pays for 28%. So which system is better? I think it's based on who you ask in individual opinion. While the Colombian system reaches more and is less of a financial burden on individuals, the quality of care is still a big risk for the country. They still have a lot to improve in terms of quality. Population health in the U.S. outranks Colombia, and violent crime remains much lower in the U.S. Despite the gun violence. Regardless of this, these rates are dramatically improving in Colombia and at faster rates than in the U.S. So without significant changes to our system, I think we may soon continue to fall behind more developing countries in terms of efficiency and quality of healthcare. These are my references, and that's the end. Thank you.